Hello, my name is Sarah and I work at the Elmhurst Public Library's Makery. Today we're going to be talking about 3D printing and how the library's 3D printers are being used to support the medical community during this pandemic. I'm sure many of you have seen stories in the news and on social media about the maker community, especially the 3D printing community, coming up with innovative ways to create personal protective equipment and other medical devices for local hospitals. Elmhurst Public Library has two models of 3D printers, the Lulzbot TAS6 and the MakerBot Replicator. Both 3D printers are considered FDM 3D printers and work exclusively with PLA filament. An FDM 3D printer has different capabilities than an SLS and an SLA 3D printer. After doing some research, we concluded that we were going to be printing face shields and ear guards that have been tested, reviewed, and approved by the National Institute of Health. A face shield is the first line of defense that a medical professional wears to protect themselves against COVID-19. It is worn over top safety goggles and a face mask. The purpose of the face shield is that any water droplets carrying the virus get blocked by the clear plastic sheet so they don't reach the face. This design was approved by the National Institute of Health to be printed in PLA filament. It takes about 3.5 hours to print and then construct, and it includes this visor that protects water droplets from getting into the eyes through the forehead. After printing the visor piece, a clear plastic piece, a report cover, a transparency film, is 3-hole punched and fastened to the top. And we use a 7-inch rubber band or larger attached to the hooks on the back to work as a headband. Because this is open on all 4 sides, a face mask still needs to be worn underneath it. At this time, the National Institute of Health has not approved a 3D printed face mask design for FDM printers using PLA. We are also printing the ear guards, which help alleviate the pain around the ears. Since nurses and doctors still need to wear a face mask or N95 mask when treating patients, they can use this that can be worn near the back of the head to attach the elastic of the face masks so that they're not secured at the ears. Securing them at the ears causes the elastic to rub onto the skin and cut into the skin and becomes very uncomfortable, so this helps keep them comfortable. Elmhurst Public Library is happy that we're able to help in what little way we can during this pandemic. And as these items are being 3D printed, we are bagging them up and setting them aside for 72 hours. So any traces of viruses on the items can die off before being donated to Elmhurst Hospital. We thank everyone working at Elmhurst Hospital for the work they are doing at treating our patients and protecting our community. Thank you for joining us. If you have any questions, please let us know in the comments. Have a nice day.